The good thing about endoscopic surgery is instead of waiting this, a long recovery after one surgery for one hand, we operated on Steve within a week and a half after his first surgery. So he basically had both of his hands done in 1 month.
I wish I hadn't put it off for so long. I don't know how many things I put off because I couldn't use my hands like I wanted to before. I can actually feel my hands and do things, and it doesn't hurt to pick up a pair of pliers or pick up a wrench. I'm glad that I found Dr. Ray, and everything's been great since.
Seven hours of sleep a night not only helps you live longer, but also lowers your stress, sharpens your memory, reduces cravings for bad food.
When we do breast augmentation, one of the most common complications that we're trying to avoid is capsular contracture. And what that means is when you put in an artificial device in any person, whether it be a breast implant, a pacemaker, or an artificial joint, is the body makes a layer of tissue around it called a capsule. That happens in the first week, and that's the patient's own tissue. And that's a normal response. Unfortunately, in a minority of patients, that capsule can start to contract down and harden. So the breast implant, instead of resting on the chest like a dome shape, becomes rounded, pulls up, distorted, and can become painful. After breast augmentation, there are certain measures that are employed to try to prevent capsular contracture, and most commonly is to massage the breast implant daily. Nevertheless, probably about 20% of patients over the next 5 to 10 years are going to get that hardening. Now, traditionally, it's been taught that the only way to correct that is to go back into surgery and surgically remove that scar tissue and replace the implant. The aspirin after surgery actually gives us a non-operative measure to treat that. And what is involved is this: the impetus for that contracture or hardening seems to be bacteria, and it can be seeded from the breast because that's an open gland into the environment. It's the bacteria that's found on that capsule is normal bacteria found on the skin. But what happens is when it lands on that implant, it acts differently than bacteria elsewhere in the body and forms what's called a biofilm, like a shell around it, so that the antibiotics can't eradicate it. What the aspirin after surgery treatment does is an ultrasound device specially designed for the breast that imparts energy in to break up that biofilm so that the antibiotics we prescribe can then eradicate the infection and soften up the breast implant again. Now, when we see patients, the success rate of this depends on how severe the contracture is and how long they've had it. But in the typical patient that comes to us, if it hasn't been too long, if it isn't too far advanced, but it's distorted enough that they can see the distortion and feel the hardness, we get about an 80% response rate.
As always, for more information on any of the doctors you've seen on today's show, be sure to visit our website. It's bestdocsnetwork.com. Now we're going to check in with our next best doctor. It's bariatric surgeon from Bariatric Solutions, Dr. Scott Stowers, who has a very unique way of serving his patients.
Initially, we had a lot of trouble getting patients that were from outlying areas taken care of as far as their adjustments for their bands.
When you adjust a lap band, what you're doing is you're accessing the port, which is located in your abdomen area, and you put saline in it, and it blows it up just like you would an inner tube. As the food goes into the stomach, in that, which we call the pouch, it has receptors. And with those receptors is what triggers to the brain that you're full. And by the lap band restricting and holding that food in that area, you will get a full feeling much quicker than what you would normally.
We had a fluoro machine because we do all of our adjustments with an x-ray machine, and those were extremely expensive, and I had to figure out a way to get those to the patients. At that point, we decided to put that in a mobile unit, or we call it a lap band wagon, to do adjustments for patients on site or at least in their area.
This is where we do the actual follow-up appointments and also do the fluoroscopy on the patients to make sure that their band is working and to see how much their band may need to be adjusted.
The fluoroscopy machine is like a live video. They drink barium. It allows us to actually visualize it going down the esophagus, in through the lap band, and into the stomach. This gives us an idea of how everything is working inside.
It's just as sanitary, just as sterile. We use the same procedures as if we were in the emergency room or in the office.
Because follow-ups are so important to our patient's success, we've made it possible now for all patients, regardless of the type of procedure that they've had, to be able to do their follow-ups on board the lap band wagon, which makes it beneficial for the ones in Abilene, Amarillo, Waco, the different locations that we drive to. But we are the only practice in the country that has a mobile unit, and we're really proud to have this.
Heart attacks in women can be very tricky. In most people, a heart attack can be signaled by squeezing, heavy, dull chest pain with sweating and shortness of breath, and the pain may radiate to the arm and the neck. In women, unfortunately, and for some reason, the symptoms of a heart attack may be completely different than what I just described. For example, a woman may just have shortness of breath with no chest pain, yet she's having a heart attack. A woman may have fatigue, only fatigue and feeling tired all the time. That too could signal heart disease. Now, it usually doesn't, but it can. Also, just persistent and recurrent nausea or lethargy, and having a low exercise tolerance. For example, a woman who says, hey, I used to be able to climb 4 flights of stairs, and now I get to 2 and I'm just worn out. That can be a signal of heart disease in a woman. So again, whereas in most men, chest pain is a signal of heart attack or problems with the blood flow to your heart, in a woman it may be nothing more than just fatigue or shortness of breath or nausea. So don't overcall this if you're a woman, but at the same time, don't just take a symptom that could be a little bit different for you that didn't used to happen and blow it off. Do talk to your doctor about it.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
I had been living with neck pain for about 15 years. It took a few of those years to figure out that it was really my neck. It was horrible, lots of neck pain, terrible headaches, nerve pain down my arm. My middle fingers in both hands would go totally numb. Makes it very difficult to work when your fingers are numb if you're working on computers. I had had a bulging disc in my neck. It started out to be just one bulging disc, but by the time we found Dr. Rimlawi and got in to see him, I actually had 3 bulging discs.
We looked at her neck and I said, unfortunately, it was a big portion of her neck. It wasn't just one level. A lot of times people come in, they have 1 or 2 levels. And poor Tara, she had about 75% of her neck that was involved, that had some type of problem in it. She kind of felt that she wasn't fixable. She wasn't able to do the activities that she normally liked.
I couldn't do important things anymore, like my husband and I couldn't go dancing. I couldn't go on walks with my son. We couldn't go play at the park, to the point of not even being able to lift a gallon of milk out of the fridge. The quality of life had diminished greatly, and it was very depressing.
This type of surgery she had, normally it would have a big incision really from here all the way down. A lot of muscle cutting, a lot of bleeding. So there's a little trick where you can go in between this muscle and this muscle, right between them right here, and you can get away with really not cutting or hardly cutting any muscle at all. Cosmetically, it's better for the patient. Pain-wise, it's better for the patient. Recovery-wise, it's better for the patient.
The relief that I've gotten from Dr. Rimlawi and the minimally invasive procedures is such a godsend. It has been such a blessing in my life and has given me the quality of life back.
She's like a whole different person now. That's the best part about this. You see a patient, it's amazing how much neck pain or back pain can change their life and make them into somebody they're not. And then now I see her and she's so happy. That for me is the ultimate gift.
For more information about any of our outstanding doctors you see on today's show, as well as plenty of more videos, check out the Best Docs Network website at bestdocsnetwork.com.
That's right, and now we're going to check in with our next best doctor. It's Dr. Clay Cockerell.
Atopic dermatitis, often sort of synonymously referred to as eczema, even though a lot of people think eczema can be other things than atopic dermatitis. Most patients and lay people think of it as the same disease. Just sort of think of it as your skin is just too sensitive to the everyday things in the world that most normal people can tolerate without any problem. For example, when the air gets really dry, a lot of patients that have atopic dermatitis will start to break out, their skin will get itchy, they start scratching, then they get more of a rash. And in fact, a lot of people have actually referred to atopic dermatitis as the itch that rashes. People itch first and they start scratching, their skin gets irritated, they get this red oozing, and then they end up getting secondary bacterial infections with staph and other things like that that really makes it get much worse. If someone's got atopic dermatitis or eczema, for example, they need to be treated with something to prevent it from getting worse. And some of the things we use are things like moisturizers and emollients. We want to try to, if there's any secondary bacterial infections, driving condition, we want to get rid of those by using antibacterial washes. Bleach washes are very good for that, and we now have the clean body wash that works very well because that can be used both in the bath as well as in the shower. You'll also need to use antibiotics, sometimes hopefully topical, but in some cases it may have to be oral antibiotics. And then even other ancillary things we use are ultraviolet light treatments, antihistamines, topical anti-itch preparations, even in some cases anti-rejection drugs like cyclosporin have to be used in really bad cases. Most cases do begin in childhood, but there are some cases rarely that actually begin in adulthood. The good news about atopic dermatitis is that if you develop as a child, there's a fair chance that as you get into your teenage years and a little bit older that you'll outgrow it. You may still have a tendency to have some allergies and hay fever and that sort of thing throughout your life, but in a lot of cases the atopic dermatitis gets much better in the teenage years and in the 20s. It is also not contagious. It's not something you can spread the disease from one person to another. Now, one of the problem is, though, if a child is contaminated and carrying staph, that can be spread within households. It's very important that if a child is infected that they're taken care of and you try to limit that so that the parents don't get it or the other siblings don't get it, because that can be a problem.
I am a referral specialist for 4 doctors, and what I do is I receive referrals from other doctors, and then the doctors, they see the patients, and if they tell me that they need to be referred to have a CT scan or an MRI, then we choose the facility, which I preferred imaging, and then I send them an order for them to have either an MRI or CT scan.
Preferred Imaging stands out in customer service excellence. I'm able to get our patients in same day, and the patients are happy. They get in, they get out.
I've heard that patients, when they come to the Preferred Imaging, they feel like they get first-class service and very nice people to work with, and as if they were going into, you know, on an airplane flight, it's first class all the way through.
Because we get the results within 24 hours, we're able to get the patient back right away and the same week. And we can diagnose the patient via the MRI results, and we can therefore know how to treat the patient and go from there.
They're always nice on the phone, they're eager to help, and there's no miscommunication at any point at all. So it helps me when I'm able to call any facility that I can, and then they're there to help, and they're always nice. And it makes it easier for us.
Preferred Imaging has 14 imaging facilities around the Dallas-Fort Worth area, and they do have extended evening hours during the week, and they're also available on Saturday and Sundays. So it accommodates all of our patients' needs, whether they have to go after work, before work, on the weekends. They really make it easy for the patients. We send over an average of 10 to 15 a day. Our experience with Preferred Imaging it's amazing.
Laughing not only eases stress, promotes social bonding, and lowers blood pressure, and may also boost your immune system. So bring some humor into your life.
I had the four front teeth were very crooked. Two were going forward, two were going backward. I found that I had to wear braces for quite a few years, and that wasn't a good alternative for me. So I did some research. I don't know if there's cosmetic dentistry up there. I'm sure there are, but I just didn't investigate it. But I did investigate this one and thought, well, this looks like a good as any. And so I did some research, checked into it, and here we are.
Well, Ken had come from Cleveland, Ohio. So he sent me a lot of pictures and stuff before he came, and I knew I could help him out. And so he came in one night and got here late, and we stayed and took care of him, prepared his teeth, made him some temporaries that looked fabulous, let him go home, and then came in and we put them on, and he's just been really happy with them, and it made a big improvement on his smile.
I spoke with Christine quite a bit, more of a consultation type of format, because obviously I kind of skipped a couple of steps on the process because I live so far away. But she's very helpful. Christine kind of explained the process, what was done, what's going to be done, how it works, I mean, and getting the quotes and the pricing and everything. So it was very consultative, very helpful.
We did prep veneers on him, but it was not extensive. I mean, just because you have to prep the tooth doesn't mean you have to take it down. A lot of people think, oh, you're gonna have to take my tooth down to a little nub or something like that. No, sometimes it's just a matter of a little smoothing that is very, very minimal.
I was getting pretty self-conscious of when I would laugh or smile of putting my hand over my face, because I was just, hell, that's funny, and something like that. And what I found is it's somewhat liberating to the point where I find myself not doing that anymore, which is nice. I mean, actually, when I smile for a picture with my family, my kids, I actually smile instead of, kind of half smile it. And they were always making fun of me for that. So, very happy with the results. The staff is very professional. That they obviously know what they're doing, but the results are fantastic, really are.
It doesn't have to be a trip to the dungeon. It doesn't have to be uncomfortable. I would just say, come in and experience it, see for yourself. It really can be very pleasant.
For more information about any of the great doctors you see on today's show, as well as more outstanding videos, even request an appointment, head to the website, bestdocsnetwork.com. Right now, it's time to head to our next best doctor, one of the top plastic surgeons in the entire Dallas-Fort Worth area. It's Dr. David Azouz.
I had my gastric bypass in May of 2011, and after 2 years, I lost 100 pounds. After losing 100 pounds, I had a lot of excess skin on my belly. I've always been big around my belly area, so that's where I carried all my weight. I felt very unhealthy with it and wanted it removed.
The problem is when you lose that much weight, your body and your skin cannot go back to where you would like it to go back without help. And there's no way with exercise that you can get rid of the extra skin that's hanging, that has been stretched out, often has a lot of stretch marks. And in some patients, you do need to do a brachioplasty or remove skin from the arms. In some also you need to do a breast lift. In some you have to do a facelift to correct the extra skin around the face. So everyone's a little bit different. In Karen's case, her major problem was her abdomen, where she had all this extra skin and this pannus that she wanted removed, that she could not get rid of, despite the fact that she ate well and despite the fact that she was working out regularly.
When I came to see Dr. Azouz, I weighed 151, and that was because I was still carrying all the fat that was around my belly. He had explained to me the different procedures that he has. He explained to me the tummy tuck in particular. It was what I was interested in. When he examined me, he found a hernia. which he repaired while he did my tummy tuck. Dr. Azouz cut off 8 pounds of fat from my belly.
And of course, her skin was very poor quality. It was all had been stretched out from when she was a size 24 or 26.
Once I had my tummy tuck done, I dropped like 4 sizes right away. Dr. Azouz told me when I had the tummy tuck, I would lose another 20 pounds plus what he cut off. And I did. I started at 248 before my weight loss, and after my tummy tuck, I'm now at 124, size 0.
Hi, my name is Dr. Dustin Ray. If you're having a lot of pain at the base of your thumb or pain in the other joints of your hands, you probably have arthritis. To learn more, watch my videos at bestdocsnetwork.com.
We are here with one of the best doctors that specializes in the back and neck. He is a pain management specialist, a board-certified physician that treats problems with the back and neck. And some of your patients that come in, what are the most common symptoms?
Well, patients that come into my office often complain of neck pain that may or may not be associated with arm pain, numbness, or tingling, or shoulder pain, numbness, or tingling. They also might be complaining of thoracic or mid-back pain that may or not be associated with numbness, tingling, or pain radiating around to the ribs. Most commonly, they come in complaining of low back pain that may or may not be associated with leg pain, numbness, or tingling, or otherwise known as sciatica. What we find out is, upon evaluation of these patients, that this procedure addresses these conditions such as a herniated disc, a bulging disc, scar tissue that might be in the spine, from trauma, or even patients that have already had a surgery on their back and or a fusion of their back that still can be treated with this minimally invasive procedure.
Dr. Williams is one of the only specialists in the world that does a minimally invasive procedure that can detect and treat neck and back problems. Explain this procedure.
What I do is I make a very small 2 to 3 millimeter incision in a natural opening above the patient's tailbone without damaging any bone. It also has a laser, a state-of-the-art laser, and a high-definition camera that I can drive up to the patient's, into the patient's spinal canal and examine the patient's spine for herniated disc, bulging disc, scar tissue, inflammation, and then treat that patient's pain or a condition right there.
All right, Dr. Williams, so I have the procedure on my back or neck. What about the recovery time? How long?
Well, I'm glad you asked that, Jim. Since it's such a minimally invasive procedure and an outpatient procedure also, I usually can have a patient back at their desk job or office job the next week after they have the procedure.
All right, there he is, Dr. Jason Williams, the go-to doctor when it comes to back and neck problems. All right, thank you, doctor.
Thank you so much, Jim.
We had been trying to get pregnant for about 4 years. With 4 years of failed success, we decided to explore some of our options, which is where we did some research and found Dr. Doody. Went to his office, and kind of, I guess, went through the motions of identifying what was the root cause as to why we weren't getting pregnant. Problem was more my problem than hers, and identified that IVF was our only option.
In this particular instance, the difficulty was related to a sperm issue. When we treat couples that have sperm or really any other identifiable fertility factor, we'd like to directly correct it, but in certain situations it doesn't respond to hormonal treatments or there are no real good surgical options. So in this case, we did do in vitro fertilization on the couple as well.
When we got to the point of prepared for the IVF, she had gone through the egg retrieval, which we had 9 eggs, of which 7 were identified that were able to be fertilized. At the time of the transfer, we only had 1 egg that was eligible for transfer, of which he gave us a less than 15% chance of success.
So what we do is we take the sperm individually into a little needle, a little glass needle, and we place it into the inside of the egg so that fertilization can happen. It's a very effective treatment. Initially, when it came out, there were a lot of concerns that We're bypassing nature's protective mechanisms. Maybe this race where 1 million sperm would compete to be the one to win the races would make a healthier baby, but it's really turned out that babies conceived through ICSI, or intracytoplasmic sperm injection, really are as healthy as babies conceived naturally. So they went through the IVF ICSI process, and fortunately they wound up being successful.
When Dr. Doody came in, my first question to him was, do we move forward, or do we, Control Delete and back up and start over? And his quote, and brought tears to both of our eyes, was, he said, I've made beautiful babies with less. And we're living proof, that that's true.
Well, thanks for tuning in to another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas and Fort Worth area that are helping to change people's lives.
That's right. For more information on any of the outstanding doctors you see on today's show, as well as request an appointment, you can do so. All they have to do is head to the website, bestdocsnetwork.com.
And if you have a question or comment for us, we'd love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.